Hi, everyone, and welcome to another edition of the Lympha Press Educational Webinar Series. I know that many of you are just getting ready to log on. We are so excited about tonight's program, and we at Lympha Press are very committed to ensuring that our patients have quality of life. We want you to live and live fully. And that means enjoying all the things that you like to do in life. We know that Lympha Press helps you with that. And many of you have had questions over the years and even recently about travel. What are the do's and don'ts? Well, get your passports ready because tonight it's all about traveling if you are a lymphedema or a lipedema patient. And we also know that we have many clinicians out there. This is great advice that you can share with your patients and empower them to live fully. And this is going to live on the Lympha Press website, also our YouTube channel. So refer people to it over and over again. I know that even some of our expert panelists learned new things as we were putting this together, and that's a perfect time for me to do some introductions. It is an all-star panel tonight. Alexa Ercolano is part of the marketing team at Lympha Press, and many of you know her as the founder of the Lymphy Life blog, which serves the lymphedema population with such good information and patient advocacy and support. So glad that you are here tonight, Alexa. And then Catherine Rosenberg. And I know some of you are saying this looks like the lymphedema patient roundtable here. And it is a bit of a throwback as I used to host that. Catherine Rosenberg is an anchor panelist for the lymphedema patient roundtable. She is a cancer survivor, a thriver, a fierce patient advocate, and she has some really great information about travel tonight. We're so glad you're with us, Catherine. You know her as Ninjas Fighting Lymphedema, another patient advocate who is doing great things in the lymphedema community. Her story is inspiring. She's inspiring. Amy Rivera, we're so glad you're here tonight. And Angela Jones, one of my favorite people. You're all sort of my favorite people, but Angela Jones is a lymphedema patient. And she can bring her unique perspective as a person who has both lipedema and lymphedema. She is a healthy life advocate and always brings such wisdom to the table. The person driving us tonight, I'm trying to use these puns, but they don't roll off my tongue. The person who's running the ship tonight is Karen Ashforth, and you all know her as an expert on lymphedema, focusing on pneumatic compression, on fibrosis. She's so well-versed in so many different respects and bringing really good information about infections to the table tonight as well. Other things that you need to consider when you're traveling. So, having done the introductions, we want you to bring your questions and put them in the Q&A. We will get to them at the end of the program, and we're going to do sort of a roundtable at the end. Yes, this is being recorded, and as I stated at the start, everybody who registers will get a copy of the recording, and you can also find it. It will live forever on the Lympha Press website. Having said all that, I am turning it over to you, Karen Ashforth, and I thank you for guiding us through this excellent information.
Thank you so much, Brenda. And it's such a pleasure to be here tonight. And I think that this topic is so important because anyone who's living and thriving with lymphedema or lipedema is going to benefit from this rich, wonderful treasure trove of information that we have. So without further ado, I have a PowerPoint that we've all put together and collaborated on. So I'm going to go ahead and share my screen. And we're going to start the slideshow. All right. So I'm going to go ahead and kick things off. And just starting with a little bit of a clinical overview, I want to emphasize that people with lymphedema and lipedema have different risks than the general population, and that knowledge is power. If you can be prepared and know what to look for and know what to do, then you're going to have a much better experience. So we'll talk all about that in a minute. And then we're going to have each one of our lovely panelists talk about their particular tips in terms of planning and packing, protocol and practices. And then we will wind everything up with a group discussion. So please, if you have any questions, feel free to put them in the Q&A box. If you have any hot tips, we would love to hear them, and we'd love for you to drop those in the chat. So moving ahead here, I'm just going to dive right into infections, because that is, I think, even worse than missing a flight. It is so important that you know that the most important function of the lymph system is to process and destroy bacteria, and that people living with lymphedema are 71 times more likely to develop an infection than those without swelling. So it's very important to recognize the signs of an infection and be able to act quickly, because untreated infections can actually be life-threatening. So you don't want to lose any time rushing into treatment, because every hour that you delay, it can get worse. Now, why are we talking about infections now? Because travel actually increases somebody's vulnerability to an infection, even people without lymphedema, because of a number of reasons. First off, when we travel, we're typically more sedentary. Whether we're doing a plane, train, automobile, we tend to be sitting more and not moving around as much. And we all know that the lymph system relies on our muscles to be able to work efficiently. So if we're more in that resting mode, and especially if we're traveling seated with our feet down and we have foot swelling, boy, being in that dependent position for a prolonged time sets us up. So elevating limbs during travel can be a good solution, but it can be challenging depending on how you're traveling and where you're seated. We'll talk about that more. Another thing is altitude, because altitude impacts swelling. Think about air pressure as an extra compression garment. So those of us who are close to sea level have a lot of air pressure pushing against our body. But when we're up at altitude in the mountains or in an airplane, because most airplane cabins are only pressurized to about 6,000 to 7,000 feet. So that's kind of like being way up in the mountains, and suddenly we've lost that extra compression garment because the air is thinner and we're not having that same pressure pushing against our body. So that's why high altitudes are a risk. If you're traveling to the mountains or flying on an airplane, you need to be especially mindful of all the things we're discussing. So these are a couple of pictures of what an infection might look like, and it can be different for different people. On the left, you can see all the little spots. On the right, you can see one big red area that has been outlined with a Sharpie, and you can see that above the Sharpie, it's normal skin tone, and below the Sharpie, it's red. So that is one of the cardinal signs, is redness, as well as heat, pain, and increased swelling. Some people will feel like they are feverish and might even have chills and sweating. And other people might feel fatigue or a sense of malaise or flu-like symptoms. There definitely would be pain or tenderness in the affected area, and it's likely to spread and spread quickly, which is why we've got that area on the right outlined in a Sharpie, because that way, if the redness starts to spread outside the lines of the Sharpie, then that's a clear tip-off that we've got an out-of-control infection that needs to have antibiotics. So this is something also, if you notice tightness or glossy, stretched appearance of the skin, that's another tip-off. And bottom line is, if you suspect anything, get yourself to medical care right away because you do not want to delay. This can be potentially life-threatening. Now, there are some people who look like they have an infection all the time. And my next slide is illustrating one of my patients who has what's called erythema. Notice the difference between erythema. She's got it in both of her legs, and it's symmetrical. You can see that the legs both kind of match in terms of having that red colored band around her ankles and lower legs. And this is something that is an inflammatory condition, not an infection. But I don't want you to try to diagnose it yourself. Just know that if it's something that comes on fairly rapidly in a specific part, it generally doesn't affect more than one body part at a time unless it's so advanced that you've gone septic. And then, boy, you're probably going to end up in the hospital with IV antibiotics. We don't want you to get that far. So let's talk a little bit about what to do if you have an infection. You don't want to do anything that could potentially spread the infection. So even after you're on antibiotics, you don't want to do any MLD. You don't want to exercise vigorously. You certainly don't want to use your compression pump the first, initial period while you're trying to get over the infection, because any of these activities could actually spread the infection elsewhere in your body. You do not want that. My understanding, most of the doctors that I work with give patients clearance to resume those activities, generally 3 or 4 days after being on antibiotics. But the important thing is that the doctor needs to feel confident that the infection is receding. And so the symptoms need to be getting better, not staying the same or getting worse before you can go back to using your pump or massaging or exercising. However, you do want to keep wearing compression because that extra swelling is going to continue to grow and you want to contain that. And after you're cleared, doing all the decongestive activities, exercise, massage, and pumping will actually help to clear out some of the infectious wastes. So they will be helpful in the right sequence, but not at the beginning. Let's talk a little bit about prophylactic antibiotics, because I think that this is an important tool that not a lot of people know about. And I encourage my patients, especially those who have had infections in the past, to request a prescription from their doctor, fill it at the pharmacy, and then keep a bottle of antibiotics on hand just in case, especially when you travel, because the last thing you want to do is to be in a strange town, have to go to a strange hospital and find a strange pharmacy, and all of that is just so stressful. If you can just have antibiotics on hand and start taking them, then what you can do is, when you get back home, or if it happens to be the weekend, because I have some patients that will start taking antibiotics if it's outside of convenient doctor's hours, then they call their doctor's office and let them know, hey, I had signs of infection. I started taking this antibiotic. I'm on day number 5 and things are looking better. If you start the antibiotic prescription, you want to take the whole thing, because it's not going to work halfway. You want to make sure that you go through the whole course and wipe everything out. Now, speaking of wiping out, antibiotics wipe out both the good bacteria as well as the bad bacteria. So that can mean that you might have some stomach upset. It could be a problem over time. And so I recommend probiotics. You don't want to take them at the same time as antibiotics because the antibiotics kill all the good stuff. So some people wait until they finish their course of antibiotics and then do a lot of yogurt and acidophilus and, that type of thing to help to make the flora in the gut better. Some people also have problems with yeast infections, especially vaginally. And so it might be necessary to also get an antifungal prescription after you complete the antibiotics, just to help with any potential problems there. Let's talk a little bit about antibiotic ointment. I think it's important to bring that along when you travel as well, because should you get a scrape or a scratch at any time, using a little dab of antibiotic ointment is a really good prevention. And I like to recommend the single or double antibiotic. The single is bacitracin, the double is actually called double antibiotic. And the reason for that is because the triple antibiotic, which is known by the name Neosporin, has been known to cause stasis dermatitis in many of my patients. And so a lot of the dermatologists that I work with discourage the use of triple antibiotic ointment for people who are likely to get that. So that's just something to keep in mind. So now that we've had all of this risk stuff, we're going to get into the fun stuff. And I am so excited to hear from Catherine Rosenberg. She's got some great things to tell you about planning your trip.
So when you plan your trip, you have to really make sure that you are open with different people about the condition that you have. Karen, can you flip the slide for me? So the first contact that I always make is to TSA Cares. And the reason why I call them is because they actually help people who have disabilities or medical conditions with extra services to get through the airport. So they can get you to the gate. They can also help you through security. So I'm a patient who actually brings my compression pump on the airplane. So my compression pump has to go through the scanners. So I make them aware ahead of time that it's coming with me and what it is that's inside that with the electrical devices, because you have to take all electrical devices out of your out of the bags so that they can check them. So I call them ahead of time, and it's best to call them at least 48 to 72 hours ahead of time. They will meet you at the airport, and they will have somebody who helps you get all the way through security, as well as all the way down to your gate. And if you need to stop to use the bathroom, they'll make that stop for you too, which is a good thing. So I have found it to be very, very helpful. And I did provide a copy of the card that was actually given to me in the Philadelphia airport, because TSA, I was seeing the same person on a regular basis because of the fact that I was flying regularly, and he handed me this card and said, you might want to use this. So I decided to give it a shot, and it worked out really well. So Karen, can you flip to the next slide for me? So the next place that I contact is the airline. And the reason why I contact the airline is because I need some accommodations for my flight. And some of these things seem kind of, standard for most people, but for somebody with lower extremity lymphedema, it's kind of really important for me to be comfortable when I fly. So in terms of that, I either make sure I have an aisle seat. However, I do prefer a bulkhead row seat. And the reason why I prefer the bulkhead row seat is because I like to put my feet up on the wall while I'm flying. And the last super important thing for me is that I make sure that they are very well aware that I need to be able to walk up and down the aisles of the airplane. I typically do it about 2 times every hour of my flight. And one of the best ways that I find for me to be able to walk up and down the aisle is if I'm sitting all the way up in the front of the plane by the bulkhead row, I'm going to use the bathroom in the back of the plane. So that this way it forces myself to walk all the way to the other end of the plane, use the bathroom, and then walk all the way back. So I'm getting my steps in with my exercise and movement while taking care of business at the same time. And then another tip that we have is some airlines actually have the ability for you to purchase a second seat if necessary, just so you have that extra space. And some airlines, in particular, I know for a fact that Southwest does this, will actually refund you the second seat after your trip is fully completed. You just have to call them and let them know that you had a physical disability, and they will work with you in terms of being able to refund you that seat. So you're only you had to pay up front for both seats. However, after your trip is complete, you get the full refund of all, including all taxes and fees, refunded back to you. Can you switch to the next slide for me? So another important thing is to make sure that you have some medical notes. So this is an example of an actual medical note that I got from one of my doctors before I was flying. So that this way that they realize that I can't take my compression garments off. There may be compression wrappings on, and that my pump has to fly with me. And that is an important document to have with you, especially when you're going through security. So that this way that they don't have you take off your compression garment or your wrap, which can take a while to redo if you're, in a rush to get through security. And every time I've gone with having that doctor's note, they've never made me take it off. However, there are sometimes some questions about it, but you'll hear a lot of us say that use it as an educational time. It's super important because sometimes the security people don't understand what we're dealing with, but then they realize that it's a more common than normal, than others realize. Can you flip to this next slide for me? So some of the pre-flight preparations that I do include being able to participate in reduction strategies, typically about a week to 2 weeks before the flight. I will schedule myself with some extra sessions of manual lymphatic drainage with a certified lymphedema therapist. I will do some extra pump sessions. I will typically do 2 to 3 times per day for 60 minutes rather than 1 to 2 times per day. However, that is totally up to you communicating with your physician and your therapist on what they recommend for you. Instead of using a daytime flat knit compression garment, I will use compression bandages so that this way I can ensure that my lymphatic limb is in the best possible state prior to a flight. I will also use a pool or exercise so that this way it helps in the reduction ahead of time for me. So again, that my leg is in the best possible state for flying. Karen, can you switch this slide? There we go. And then when it comes to eating and drinking, it's important for me to limit my salt intake so that this way I can prevent additional fluid from building up in my body. And I typically do that about 1 to 2 days ahead of time. I also drink lots of water, and that allows the lymph fluid to flow better. And I typically start to do that 2 days ahead of time as well.
Great. Thank you so much. This is really awesome information. And now we're going to move on to hear from our travel diva, Alexa Ercolano.
Thank you for that introduction, Karen. Ciao, everybody. Whether it's hopping a train for a work trip or catching an international flight, I do a fair bit of traveling. But just because I'm on vacation doesn't mean my lymphedema is. Without all my usual tools and routines, I need to listen even more closely to my body and do what I can to alleviate my symptoms so that I can enjoy a swell trip rather than a swollen one. So, next slide, please. When traveling to Italy last fall, I made a 3-part video series on my Instagram account showing a few of the things I packed to make sure my swelling was managed while away from home. So we're going to play them for you now. The first one is compression garments. Definitely a planner. And when it comes to my lymphedema, I like to plan for that too. Whether I'm traveling a few states away or an ocean away, my legs get a one-way ticket to Swell City, which means both legs, not just my primarily affected one, get super swollen, dense, and heavy. So here are a few things that I'm bringing with me on an upcoming trip to help manage my lymphedema symptoms while I'm away from home. goes without saying that I am bringing as many compression garments as I can. All of my comfortable and most recently acquired ones, which have the best containment. So these are my thigh highs that I normally wear on my right leg. And to help my left leg, I'm bringing a bunch of knee highs. This will help manage the swelling in my less affected leg, which always without fail gets more swollen and dense during travel, whether it's sitting in planes, trains, and automobiles for hours at a time, or just all the extra walking I'm doing when I'm at the destination. I like to have as much support as I can from both my legs. So both right and left legs will be suited up so I can have the best management I can while enjoying my trip. So I'll be bringing this for nighttime wear, my new Medi Circade profile. It has the regular night garment and then this really jazzy cover over top in the Circade giraffe print. So with all the walking I knew I'd be doing and the triggering yet delicious food I'd be eating, I knew my legs would need some extra support. So in this next video, I'll show you a few tools I brought with me to help me manage my swelling. Oh, there we go. For a little extra help on days where my swelling is really bad, I'm bringing along some bandages and these great little ComproFlex pads that my lymphedema therapist gave me. These go on either side of the ankle bone, so I can wear this underneath my nighttime compression and then do the wrapping over top, a little extra support overnight. Another thing I'll be bringing for added support are these BioFlex bike shorts. These BioFlex shorts are made of a special material that helps massage and move the lymphatic fluid. My therapist recommended that I wear these to get added support above where my thigh high cuts off. It's also why I'm wearing regular bike shorts right now, but the BioFlex ones are specially designed for lymphedema and lipedema. So these are really great and comfortable. Okay. So in the last two videos, we showed compression garments and other tools I packed to help me manage my swelling while abroad, but traveling with lymphedema is more than that. It's also about packing lymphy-friendly shoes and clothing that comfortably accommodates your compression so that you can be present during your trip rather than preoccupied with your swelling. So we'll play the final video here. Lower extremity lymphy is only as good as their comfortable footwear. So I got these sneakers recently from a brand called Rivera. They have a lot of give. I've worn them a lot already in preparation for the trip without any issues, and they fit my compression garment and like a sock pretty comfortably. Last but not least, I am bringing some comfy, flowy, lightweight pants. I don't like being constricted, especially with my leg, and knowing that both can be a little extra swollen. I have these flowy pants so I can be comfortable, but still feel confident in what I'm wearing. Any lymphy knows that non-restricted clothing, whether you're upper or lower extremity, is super key in being comfortable and making sure that you're not aggravating your swelling any further by wearing something that's too tight. Now to help get my leg ready for the trip, I'm being very compliant wearing my compression garments, but I'm also using my Lympha press, pneumatic compression pump. I usually use it about 4 or 5 times a week anyway, but I'm really kicking it up before the trip because I won't have access to it while I'm there. No outfit is complete without your lymph pants. I use this at night, laying on the couch for about an hour when it is the perfect bedtime routine. I know a lot of people who like to pump in the morning. I'm a nighttime pumper, but this is another great tool to help me get ready for my trip. Make sure that my legs aren't too swollen while I am away from you. All right, and there's a lot more to include on our lymphedema packing list, from sunscreen and skincare to antibiotic ointments and other first aid supplies to protect against infection. We'll go over that in another couple slides, but first, in addition to packing garments and tools, it's also helpful to pack some strategies into your metaphorical suitcase. This could include checking the, can you go back one more, Karen? Sorry. This could include checking the weather at your destination ahead of time, especially if it's hot. Spending a lot of time in the heat can aggravate swelling, so you'll want to be prepared in order to keep yourself comfortable. Hydration, no matter the weather or activity, is also important, as is wearing your compression. And if you're going to do some sightseeing, go in with a plan. I visited Pompeii for the first time a couple years ago and learned this the hard way. We had a vague idea of the sites we wanted to visit there, but we didn't realize just how big Pompeii was or that certain sites were open on certain days or times. So we ended up doing a lot of extra wandering around, 4 hours in the heat. Whereas if we did a little research and plotted a route ahead of time, we could have been more efficient and see everything we wanted to while taking care not to overexert my leg. Remember also to advocate for yourself, whether it's asking your travel companions if you can stop and sit for a minute, head back to the hotel room to elevate, or asking a guide where a rest area is. Don't be afraid to advocate for yourself and your needs. And if you're going to another country, learn some key phrases in the local language and keep them handy in your pocket or on your phone, such as, where can I sit down so you can rest? Or may I have an extra pillow if you need to elevate? You can even keep some lymphsplanations on hand too, like, this is a medical garment, or I have lymphedema, it's a chronic swelling. Okay, we'll go to the last slide. So the patient panel put our collective heads and limbs together and developed this quick list of packing tips. So when packing clothing, consider bringing clothes in various sizes that will comfortably fit your lymphedema at different stages, depending on any changes in swelling you may experience during travel. If you have lower extremity lymphedema, packing shoes that will accommodate your swelling and compression is important, such as sturdy sneakers or even a post-op shoe if you're bandaging. If you're going to a beach or a lake, wear water shoes to protect your feet from any cuts on sharp shells or rocks. And don't forget your compression supplies. These may include your daytime garments, be them flat knits, Velcro wraps, and reduction kits, as well as gentle detergent to launder them. And if you're a wrapper, you may need to bring along extra tape as well as 2 sets of compression bandages for nighttime compression. To help keep your compression garments from sliding down during wear, a glue like It Stays is a game changer in keeping your stockings up. And you also want to make sure you pack your nighttime garments because lymphedema never sleeps. Also, bring a travel-sized kit with bandages, skincare products, antibiotics, and any other lymphedema care essentials to keep with you just in case a lymph emergency pops up. All right, next slide. What about compression pumps? You want to pack an electrical outlet adapter or a voltage adapter if you're going overseas. Your pump does not count towards your carry-on bag allowance because it is a medical device. So as Catherine mentioned earlier on, you want to let them know when you're checking in or call ahead of time that you're bringing this medical device. And caution, checking your compression pump is a risk because airlines won't take responsibility if it's lost or damaged. And we'll go over that in a couple slides, how to pack your compression pump if you're checking it too. So next slide.
Great information, Alexa. Thank you so much. And next, we're going to hear from the wonderful Amy Rivera and talking about her protocol while traveling.
Thank you. You can go ahead and go to the slide. So we talked about all the great things of traveling, tips and tricks and all these wonderful things. But what about the pesky anxiety of getting through the security line, right? We all dread that moment. It wasn't until a few years ago that I had a turning point that taught me the importance of advocating for myself during that intense moment of getting patted down or getting questioned, what is this on your limb? And so it wasn't until I had a conversation with a security officer who was patting me down and she asked me, what is this exactly? And why do you have to have all these bandages? So instead of getting aggravated and insulted, I took this upon myself to think of it as a way to spread awareness. And so as she's patting me down, I'm explaining this really cool condition called lymphedema, right? And how rare it is, you know, and all this information. But I also explained to her that everybody has a lymphatic system. So it's really important to understand what happens to it when it malfunctions or it's missing. And during this conversation, I think she forgot she was patting me down because she was so intrigued with the information I was giving her that she realized her mother had lymphedema and they didn't know that's what it was. So fast forward a couple months later, she emails my foundation and we're able to help her mother get a diagnosis. So that's when the light bulb turned on that this is actually a great way to educate others and spread awareness while they're patting you down. So I thought it was a great idea to, you know, what Catherine said, bring that medical note, consider wearing a medical bracelet that also explains your lymphedema. And it's also a good way to kind of start the conversation if you don't really know how to start that conversation. Next slide, please. So we talked about all these great protocols. Let me move over here so I can see it. And we all agree upon we have to wear compression. And we have to wear compression, especially during the flight, as Karen mentioned, with the decrease of the air pressure, we do lose that extra layer of compression. So always make sure you wear your compression. Even your shoes is a form of compression. They're a form of compression. So don't ever take them off. I learned the hard way. Trust me, my little toes were like swollen little digits, even with my toe cap on. It was really hard to put my shoes back on. So please keep your shoes on because they also are a form of compression. As Catherine stated earlier, hydration is very important as well. Drink plenty of water, but sometimes if you get a little depleted in salt or sodium, drink some warm teas. I love warm tea. Not only does it replenish me, but it also just warms up the lymphatic vessels and just warms everything up internally so things can move smoother throughout your body when you're in that airplane. And if you can at all costs avoid alcohol. I know some of us kind of like to, you know, get a little loosey-goosey on the plane, but try to avoid that because you're definitely going to go into Swell City, as Alexa explained earlier. It is not the best idea. And again, if you don't like to drink the water on the airplane, which we all read about, bring your own water bottle. Plus, you're reducing your carbon footprint. So it's a win-win for the environment and your lymphatic system. And movement. Catherine explained the importance of movement, which, by the way, I had learned that tip last night for the first time, walking to the bathroom furthest away from your seat. I will start doing that because I do travel quite a bit for personal and business. So what kind of ways can we move if we can't get up and walk, or maybe we're too embarrassed to get up and walk? Even when you're sitting down, you can do ankle movements. Or if you have upper limb lymphedema, you can do wrist movements. You can do little bitty movements that will keep things moving. And the one thing that we can do that we just often forget about is breathwork movement. So while you're sitting there, you can work on your deep breaths that not only will help your anxiety levels, but it will also keep things flowing through your abdomen. You don't want to get stuck like I do. And the last thing I would say is try to avoid wearing restrictive jewelry. And like Alexa said, she brought out her beautiful flowy pants. Wear stuff that's less restrictive because it may look nice, but later on you're going to be very uncomfortable and you just don't want to restrict any movement that you possibly can. And the last thing is elevation. How the heck do we elevate on a plane? Well, I think we've come up with some pretty cool alternative ways, just trial and error. But what I do is I'll bring a small pillow with me and I will put the pillow underneath my legs, sometimes underneath my ankles or behind my knees. And I will just do this over the pillow to kind of give me a little extra movement and elevation. Or you can ask the stewardess if you're on a long flight overseas, they often give you a blanket. You can roll it up and put it underneath your ankles or your legs as well.
Thank you so much, Amy. Such great information. Now we're going to move on and hear from Angela. I think you're muted, Angela, so go ahead and turn your mic on.
I forgot all about that. I travel back and forth from Arizona to North Carolina a lot, and I tend to, of course, take my garment. My garment is the full pants and the pump, so I don't use it as a carry-on. I do check my luggage. So next slide. This is my pump that's all wrapped in
We
So
lost
here
your
we
sound
go.
again there, Angela. Can you
Fine.
just take it
Bubble wrap
from this is
secured
my
pump.
pump?
Okay. This video is a little bit about how I pack my pump for travel. So here we have my bubble wrap secured pump along with my Lympha press pants, my cord, of course, that go to the pants, and then I kind of secure those a little bit with bubble wrap. I should own stock in bubble wrap. And then I cover everything with the remaining bubble wrap. And trust me, I have a couple of more rolls if needed, but then it zips very easily. These are my fragile stickers that I get from Delta when I check in at the kiosk. And it zips fine. It's not overcrowded, it's not overpacked. On occasion, I'll put maybe a pillow on top of it or something like that to further secure it. Since the bag that I need to contain all the components is too big to be an overhead carry-on, I have to do whatever I can do to secure it in the luggage to check-in. So thank you. Next. My advice of things to do before you travel, one of the best investments I've ever made was to pay for a 5-year membership for TSA PreCheck. It eliminates having to take the shoes off, having to take the belt off, having to take everything out of the carry-on bag that you do carry on, and it just gets you through security just a little bit faster. I think when I got mine, it was like $85 for 5 years or something like that. I don't mind spending extra on a plane ticket. My family tells me I'm kind of spoiled because I just insist on first class, but I do like the extra leg room, and it's really good for my, for my legs. I get more leg room, I get more seat room, and it's far more comfortable. I tend to use the same airline. I'm a Delta fan, so I tend to use the same airline because I know pretty much their planes. I don't travel by the date I want to travel. I travel by the plane I want to be on. So I know a lot about their fleet, and I tend to stick with that same airline, and I like the benefits that I get from them and the comfort that I get flying 6, 7, or 8 hours at a time. One thing I like to do too is pack healthy treats so that I won't eat salty, unhealthy snacks. I have a tendency, and a lot of people do when they travel, you want to gather all these snacks as your companions while you travel. So I tend to pack like apple slices or orange slices or carrots or something like that. Just something healthy. I also like to reduce my sodium a few days before I start traveling and eat more fruits and vegetables, more watery foods before I travel. Again, my family says I'm spoiled. I don't like road trips anymore. 4 hours in a car is long enough for me. So I limit any kind of road trip to 4 hours at a time. If it's over 4 hours, I will be on a plane. I'd like to pack everything 2 to 4 days ahead of time, except my pump, because to me, it's very stressful and almost traumatic to have to plan for a trip, to have to get ready to go. Am I going to get there on time? Am I going to be late? Am I going to make my connection, et cetera, et cetera? So it's kind of stressful for me thinking ahead of the travel. So I tend to pack everything 2 to 4 days in advance. I put the luggage by the door, just leave it alone and don't worry about it. I pack my pump on the day that I'm actually going to leave after using it before I board a flight, before I leave for the airport to board my flight. Something that I found important is to know the temperature of your destination so that you can dress and pack accordingly for that. A lot of times when I leave Arizona, I might be leaving 100-degree weather, going to North Carolina into 70-degree weather. And so it's very different. You need to know a little bit about the humidity too, because it does aggravate both lymphedema and lipedema. So make it a practice to know the temperature and the humidity of where you're going before you go. And be aware that there are differences in time. Right now, I'm 3 hours ahead of where I usually travel to. I'm sorry, 3 hours behind. So it's a good idea to know the time differences and give yourself enough time for your body and your mind to adjust to the difference in time when you get there. Next slide. Go back one.
Yeah, sorry about that.
Okay, that's okay. I also like to schedule a lymphatic massage therapist 1 to 2 days before I travel to help my lymphedema, my lymphatic system start out in as good a position as possible. And also I'll schedule one for 1 to 2 days after I arrive at my destination. So wherever I go, whether it's Arizona or back here or wherever I go, I tend to know lymphatic therapists in different locations. So I'll just call and say, look, I'm going to be in town. I'm going to need a massage. So I like to do that before and after travel. And this just goes with what I just said. Do your research to find a good lymphedema therapist if you're traveling to a place where you don't have a known therapist. I leave my compression stockings on for about an hour or two after I arrive. To me, travel is traumatic. It doesn't matter even if it's comfortable, it's still traumatic to me because I'm going from one place to another and I'm usually flying for quite some time. So I like to leave the stockings on just to give my limbs a chance to adjust to a new environment, to adjust to being still finally, to adjust to being in a new place. And another thing that I found so important is to be kind to yourself when you arrive at your destination and allow yourself time to recover. A lot of times when I fly from, say, Arizona to North Carolina, I don't get up until 2 o'clock the next day in North Carolina, and I'm okay with that. So just allow yourself some time to recover after your travel. Okay, next.
Thank you so much, Angela. So when you land, you want to make sure that you are taking a walk, because the muscle pumping action of walking with your compression is going to help to decongest some of the swelling that you might have acquired while you've been traveling. And doing self-MLD, as Angela mentioned, getting a lymphatic massage or using your pump to decongest the travel swelling. I love the suggestion of getting underwater, especially if you're going to a tropical destination, because getting underwater is going to give you a lot of great pressure courtesy of the water. Every foot of depth of water gives us 22.5 millimeters of mercury compression. So if we're standing in water that is chest deep, then we've got maybe 80 or 90 millimeters of mercury. That's a lot. And if we do some gentle walking in the water, then we're getting both the external water compression and the internal muscle compression, which really is very effective for moving lymph. I know we've already mentioned using sun protection and sunscreen, but I just found out from this group that there are some brands of compression garments that are rated for sun protection. So that's something that we didn't have time to research all of them, but just know that and be aware of that you can actually get a little extra protection from your garments. Speaking of which, we want to end with this fun picture from Alexa of what to do when you're traveling and you need to wash your garments. And I'm going to go ahead and stop sharing because we are now going to open things up. I see Brenda's back and we're going to go for all your questions and tips and comments. So here we go.
We had such robust chat. We want to thank all of you who have logged on to the live tonight because your insights and your cheerleading too has been so appreciated. People are loving this topic. And I want to thank all of the panelists too for sharing your personal experiences, which makes it really more impactful because you're living it and you're doing it so that you can have a swell time, not a swelling time. I love that one, Alexa. That was really, really good. So early in the presentation, Karen Ashforth, I want to go back to something you said. Ruth Lehrer wanted to know, you used a term stasis dermatitis. Could you explain what that is?
Absolutely. So that's an irritation or a rash that can happen on the skin as a result of reacting to that triple antibiotic. Not everybody gets it, but enough people do that it's just a good idea to avoid it.
Excellent. So I know that many people will be watching the replay and they weren't privy to the chat. And something came up that I thought was really interesting. The question was asked by Lana Berkovich. Alexa, why didn't you wear a thigh-high stocking over the non-involved leg? Why just knee-high? So could you answer that for the audience that's going to watch the replay?
Of course. So when I wear, well, let me back up. So my non-affected or less involved leg, it does get swollen or a little puffier during travel or long periods of sitting. So to kind of mitigate that, I have a bunch of like old knee-high custom compression garments, closed toe, so I can wear them on the right or the left. So I wear those on that leg, or I'll get off the shelf compression garments to wear on that one too. I don't have thigh highs for that one because unfortunately insurance, I have to prioritize the more involved leg when getting my custom garments. So it's hand me down old knee highs for that leg for now. But with the way that my lymphedema is progressing, I'll probably have to get custom for that leg eventually soon. So that's the main reason. And Lana had also brought up with the BioFlect bike shorts, why not wear, they have full length leggings as well as the bike shorts, which I ended up buying the full length ones a few months after that video was recorded, but those are really great to wear too for added support over your compression garment or your, your other leg if you don't wear garments on that other leg. And I think they have upper extremity pieces as well. BioFlect does. So they're really great if you want to look into those.
I see Karen Ashforth nodding at that comment, and we still have bunches of more questions. Thank you so much, Alexa, for answering. So Christine Ackridge wants to know, she saw the clothesline there, she saw things hung up, but what are the best supplies to pack for hand washing custom garments, especially in humid areas where drying them can take quite a long time? Anybody have thoughts on that? Go ahead, Catherine.
So I actually have a bottle of Gelastic compression garment soap that you only need a teeny tiny little bit to get quite the, I'll call it soap suds. So if you're hand washing, or depending on the garment, you can wash them in a washing machine. Some of them, you just can't put them in the dryer. However, it is important just to make sure that you hang them to dry, and make sure before you put them on that they are completely dry, because obviously you don't want to put a garment on your limb that is wet, because it could potentially produce bacteria underneath it, and you don't want to do that, because otherwise you could wind up in the situation that Karen had discussed in the beginning about infections. So my suggestion is always make sure that you bring enough garments that you can wash the one and have 2 more sets ready to go. So if it takes more than 24 hours to dry, you still have another clean, dry garment to be able to wear. So typically I tend to bring 4 or 5 garments with me anywhere I go, just to make sure, God forbid, it doesn't dry in time, I have dry ones, so I don't worry about, am I going to put myself at risk for an infection?
Great answer. And I saw you nodding and smiling, Amy. Do you pack multiples with you as well?
I do. Yes. Like Alexa, I do have swelling going on in my left leg as well. So now I have doubled the amount of garments I pack for both legs. And like Catherine said, it's just easier to have multiple. What if you're on vacation and something happens to your garment? I know they're expensive, and if we can afford to pack extras, that's great, because we don't want to be without them, just like we don't want to be without the antibiotics just in case there's an infection. So the more the merrier for me.
That sounds like a plan. And by the way, Catherine, you were our expert on this TSA Cares. Could you, do you have a quick access to that phone number? Because our audience members, yeah, say it again for everybody.
Hang on one second. Let me just find my favorite photos here.
This question came from Fenton from Trenton, who is one of our super fans, and he supports almost all of our educational adventures here at Lympha Press. Fenton, we appreciate you.
I'm actually going to type it. I'm actually going to type it right into the chat, so that this way people can copy it down and not have to worry, did they hear me correctly on the number that I said?
And while you are typing it, say it verbally too, for those that might need to hear it.
Okay, so it is 1-855-787-2227. Now, they are only open Monday through Friday from 8 a.m. to 11 p.m. and weekends and holidays, 9 a.m. to 8 p.m. Eastern Standard Time. So you got to make sure that you're calling during Eastern Standard Time and not Pacific Time. Because if you call at 11 o'clock at night Pacific Time, you're not going to get anybody.
Great advice. Now, one of our attendees is a travel expert herself, Sandy Darley, and she adds, remember to take an extension cord. Ah, see, this is so good. This is the power of community. We thought we had covered every possible thing, and thank you for adding that. That's so important. Ruth Lehrer asks, does anyone bring any gel seat cushions of any kind to help them as they're traveling? Anybody?
If traveling by car, I will definitely bring cushions for that. I'm also a big train traveler. I don't normally bring a cushion on the train, but I'll ball up, like a sweater or something to make it a little more comfortable. And I love taking the train versus planes when I can, because it is a little bit more room, or a little more freedom to move about the cabin, so to speak. So we don't want to exclude train travel from our travel talk tonight. That is also a comfortable way to go if you have lymphedema.
I really also appreciated, Angela, your points about preparation. And Catherine, you mentioned that too. It's almost like you're in training to have a good time when you're on vacation. So you have to be really intentional about that. I appreciate how you shared that. And I'm all about first class, Angela. So lymphedema, lipedema, or not, I think that is the way to go. But I really appreciate what you shared there. Lana also recommends placing a garment that is wet between layers of towels and walking on it to get the extra water out of the garment, and also using fans. Not fans like Fenton from Trenton, but blowing fans that will help to dry it. Thank you for that tip. That's excellent. We love to know that the people out there are traveling. An anonymous attendee said something that really touched my heart, and I don't know if we have any advice for them, but going to the washroom on board an aircraft is really difficult because that means removing the compression, and this person has genital lymphedema. Do we have any tips for this wonderful participant? And we're so glad you're with us tonight. We hope you found some of the information helpful. Anybody about the compression garments, genital lymphedema, and how to make those trips to the restroom not so challenging?
I always carry wet wipes with me when I travel anyway. And so that could be a helpful thing just for cleansing after using the restroom. I am a clean freak, so I'm using those alcohol pads to sterilize everything. And when I'm washing my hands in the restroom on the airplane, I will soap them up, and then I will soap the faucets so that when I turn it off, that I'm not touching a dirty faucet with my clean hands. I also like to make sure I get the towels out first, but I digress. Genital lymphedema can be fairly tricky, especially at altitude. And I'm going to tell you my all-time favorite genital decongestion tip. And you can do this in the restroom because it might feel a little awkward to do it in your seat, but it's basically a pull-up where you take a towel or a scarf or anything that you can sit on and put between your legs, and then you pull it up towards your chest, and you're basically doing little pumps to help to compress and stimulate the genital area so that you can move that swelling. So that would be another little tip. There are little wicking fabrics that you can use, and I'll drop a link in the chat so that if you sweat a lot, because sometimes that can be an issue if you're compressing the genitals and sweating, that's not very comfortable. I would say you need to just pull out all the stops in terms of wearing any type of quilted compression, if that's helpful to you. Just everything you possibly can. And then I don't know that you could use on the airplane, but I love recommending mini vibrators to my patients with genital lymphedema. Another thing I recommend is, believe it or not, a paint roller that you can use to help reach and direct fluid from the genitals towards the inguinal nodes. So I'm going to stop here, but I wanted to just share a little bit because that is a toughie. And my heart goes out to you, but there are some great tools out there.
Awesome. Thank you for that answer. And thanks for the question too. So everybody wants to go to Italy. Alexa, you've made us all jealous. And one question came in from Jeannie Proctor when traveling to Europe. What type of adapter is needed to use my Lympha press? And then chatters weighed in. Rachel Smith says you need a special step down adapter if you use a Lympha press in Europe. She used a regular adapter her first trip and it blew the fuse. And then she didn't have her machine the whole trip. I'm so sorry you had to learn the lesson that way. Does anybody want to speak to this issue of adapters and preparation? Maybe, and someone in chat also suggested call the hotel in advance and see if they do have extras on hand to help support the people that are traveling to their lodging. So any thoughts on adapters? Or do you think that that pretty much covers adapters?
I just want to say, I haven't traveled internationally with my pump, but I know someone else who did years ago before pumps were more, I don't know, advanced as they are now. And she ended up blowing the fuse of the hotel she was at. So you're lucky you only blew your pump because it could have been a lot worse. But I think I agree. Calling the hotel ahead of time is a good idea. Maybe contacting, I'd have to look up, I don't know, but contacting Lympha press or whatever medical device you have, contacting the manufacturer to see what they recommend as well would be helpful.
And the Lympha press was designed to be able to take it with you. So we hope that you are, and hope you're using your pneumatic compression pump when you're traveling. Sandy Darley, our travel expert in the audience, also says you don't just need an adapter, but sometimes you also need a converter. So these are the good questions to ask to make sure that you can check ahead for your adapters. You cannot charge any of your electric devices with US plugs. Thank you, Fenton, for weighing in on that. Kia Lucarelli asks, is it recommended to wear layers of compression garments on an affected limb? 2 pairs of compression thigh highs on one leg? So doubling up? Any thoughts on that?
Well, I think it depends on the individual and their lymphedema. I personally have to double up. I blow through one garment, so I have to wear a class 2 and a class 3. And if I don't wear them, I immediately start to swell because my skin integrity is so poor in my right leg. But I'm very different, so it could just depend on the individual and what is the best protocol from their therapist and how their body responds. So I think it just really depends on their lymphedema.
Anybody else on that topic?
Yeah,
Alexa.
I'll weigh into. I'm one of those people who can't double up comfortably with my flatness. Just wearing the one sometimes is painful enough. But at nighttime, sometimes I've been told by my lymphedema therapist, wrapping over your night garment, if you wear one of those quilted nighttime garments, is a good way to get extra compression. Or combining your night garment with your pneumatic pump. When you're doing a compression pump treatment, you can wear your garment under that for a little extra zhuzhing of your fibrosis. It helps move that. So double up in that way.
Excellent.
And I do double up it like that with my Lympha press and my nighttime. It works wonderful.
Exactly. And also like the BioFlect we talked about earlier too, like wearing that overhand, or compression leggings or compression bike shorts, like off the shelf ones, or regular bike shorts. I saw someone asked in the chat about the bike shorts, just regular ones you can wear as well. Anything that will add a little bit of extra containment.
Catherine.
So for me to double up, I used to double up compression in terms of actual compression flat neck garments, but I've actually found recently that for me to double up, I'll actually have a flat neck garment and then put on top of it an adjustable Velcro or some sort of adjustable wrap where I can kind of have a little bit more control over the pressure, so it's not as tight, but I have the ability to make it tighter if I need to.
Okay, very good. So elevating while traveling continues to be of interest to our audience. In fact, early on, when someone said elevate while on a plane, it was like, how do you do that? And then Amy, you answered that, and so did you with the whole bulkhead thing, Catherine. Karen Ashforth, did you have something else to add about elevating while traveling?
So I just dropped a little link in the chat because when we were doing our little dress rehearsal, we had a fun discussion about little devices that you can take on the plane that do various things. And so if you look at the chat, I dropped an Amazon link for a little sling that you can use for an arm or a leg. And that might be kind of fun for people. I know that it's always nice to be able to do the bulkhead. Business class is great if you can get your legs up, if you can afford that. But these slings look like they might be something else. So I think we should have everyone try them out and then do a little comparison and report back on what you think.
Well, I think a field trip is in order.
There you go. Let's all go to Italy.
Let's all, in fact, Nancy West is going to Italy, and she says, can I pack my Lympha press as free luggage? And Catherine, you want to weigh in on that?
Oh, I totally want to weigh in on this one because I think I'm the only one really in the group here that actually takes my Lympha press as a carry-on. And yes, it can. And because it is a medical device, it does not count against your carry-on bags or your personal item. And you can get it into a carry-on size suitcase that can wheel across the airport. I've actually been able to get not only the machine, but the full pantsuit plus the adapter plus the charger all in this suitcase and zip it up without having the expander open to be able to get it to be a carry-on without having to check it or without having to do a gate check either.
And I love how animated you get when you talk about this. Okay, so in this corner, there is the carry-on. In this corner, Angela, the checked baggage. Okay, let's have that. Let's duke it out here. I'm sure, Angela, there are very good reasons why you prefer to check your baggage, even though sometimes, I mean, I always sort of cross my fingers when I check baggage myself, but it's not an option for you to do it as a carry-on. Sorry, you're muted, my friend, so you're going to need to unmute. And I know, Alexa, you also have a thought on this. And I know Catherine can take the pushback. So here we go, everybody.
When I first started, when I realized I was going to have to travel with the pump and the pants, I contacted Catherine Rosenberg and I said, what do I do with this thing? How do I travel with it? And so she went ahead to tell me, and try as I might, I could not get it all in a carry-on. I went out and bought a carry-on that fit the correct size and everything. I could not get it in there. And I must have bought at least 3 pieces of luggage, took them back, went and got another one, took them back, and I could not make it work. And finally, I just said, okay, I have to take my chances. I'll secure it really well in the luggage. And when I get there, I'll let them know this is a medical device. Take care of it. And I can be kind of threatening, knowing that these people cannot protect my pump all the way to where I'm going. I go like, when I get where I'm going, it better be like I put it in the suitcase. So what they do is they put fragile stickers all over the luggage. I lock the luggage. I have not had a problem yet. I always keep my fingers crossed because I am afraid. Once I flew and my luggage got to my destination like 4 hours before I did, and I was terrified that something was going to happen. But when I got to where I was going, there it sat right outside the baggage overload department or whatever you call it. But I do it because that was the only way I could do it, was to just check it in. Also, as I told a panel earlier this week, I'm kind of lazy about carrying things. Anywhere I go, if I have a purse, somebody else is carrying it, I just don't like to carry anything. So far it's worked. And at some point I may follow suggestions by Karen that she gave about using 2 pieces of luggage to do it. But until then, I just continue to check it. And I have to say, I say a prayer before I get on the plane. Please let it get there when I do, and let it get there safe and sound. So far it's worked out.
Well, well said. And I am so glad that you are just being true to yourself and you don't like to carry an extra thing. And I'm sort of with you on that. We should go on a trip together. I love it. Catherine, I feel like you want to say something here. And someone in chat asked, do you have to put it in the overhead?
So yes, you do have to put it in the overhead. But one of the things I did learn recently, since I got the Lympha pants versus just the leg sleeves, one of the tricks of my trade of being able to pack it into the suitcase is I actually take the 2 sets of hoses and I put them inside the legs and then I roll it up nice and tight. And that's how I protect the wires because they're inside of the garment. So I'm not worried about, am I going to damage the hoses or anything like that. And then I make sure I zip the legs back up so that the wires are really tucked in there nicely. And that's how I'm able to actually get it in there.
Well said. Alexa, anything you want to add as someone who also checks?
I do, although I'm straddling the line here. I'm a pump checker, but I'm a carry-on for all my other compression supplies because I'm also so afraid of my luggage getting lost, especially when traveling internationally. So in my carry-on, I will pack all my compression garments. I will have all of that handy, as well as anything else like I know I won't be able to live without if I lose my luggage, like undies and a change of clothes and all that just in case kind of stuff. But the compression garments are always, always in my carry-on with me, like no questions asked. It is like my security compression.
Security compression. That sounds like a plan. Now, I want to close out because we've gone through the Q&A, but I want everybody to leave our audience with a final tip or an exhortation about travel. And you're always ready to say something, Catherine. So jump on in. And I say that as a compliment because you always say good stuff. But Catherine, a final tip for our audience.
Don't let your lymphedema prevent you from traveling. Use that as an educational tool to help others and to still make sure that you enjoy your trip and have fun.
I like that. That's really good. What about you, Angela?
I would say travel confidently. Make your plans. Do all you can to eliminate stress before you actually start on the trip, and just make up your mind that you're going to be okay.
Make up your mind that you're going to be okay. That's powerful. Thank you for sharing that. Amy Rivera.
Well, I'm all about thriving with lymphedema than simply surviving because I used to survive for over 35 years. So, like Catherine and Angela said, be gentle on yourself, but also make up your mind and look at it as a way of spreading awareness and advocating and living your life with lymphedema.
Living with lymphedema. Yeah, that's good. You taught me that, Alexa. I learned from you that it was a whole different viewpoint when you didn't talk about suffering with lymphedema, but living with lymphedema. And you do it so well. What would you leave our audience with?
Well, I'd like to say, I mean, everybody else kind of captured it, don't let your condition keep you from living your life and being present in your life. Earlier, before we started, we were saying, oh, the places you will go with lymphedema and lipedema. And I think it's just important to plan ahead of time so you can make those little adjustments so that way you can be present and enjoy your trip, even if it's a work trip, like you want to be able to enjoy where you are, who you're with, and just make memories and not be concerned about your leg or your arm or how it looks or how it feels. So with proper preparation, you can do most anything while living with these conditions. So
Before I go to you, Karen Ashforth, Linda Martin wrote this in chat and I want to read it because I think it's inspiring. Her cancer survivor dragon boat team from Boston, the Wellness Warriors, they're going to Italy to participate in the World Championships this September. Many of the members of that team have lymphedema. Talk about inspiring. We applaud you and we want to hear more about this. Document the trip. I'm sure you are, but I'm going to be following that. That is so interesting and inspiring. And so, Karen Ashforth, you helped to take us on this road trip tonight. So let's finish it together.
So the thought that I'd like to leave you with is, don't be afraid of asking for help. If you need to get that carry-on bag with your pump and pantsuit in that overhead compartment, ask. And ask when you get on the plane. Because all you need to do is say, hey, I've got some medical equipment that needs to go overhead. Can you please help me with it? It can be as simple as that. But a lot of people, you know, they feel shy about asking for help. And that's really what the airline staff is there for, is to be there to help us. And if you have a need and you feel like it's not something you can do yourself, don't strain and don't struggle. So that's my big advice.
That's excellent advice. It's often been said by many of the patients that I interact with, lymphedema or lipedema, I might have it, but it doesn't have me. And I want to encourage everybody that's logged on tonight and those that are watching the replay to live fully. We at Lympha Press are committed to that and to supporting you in your journey. That's why we do roundtables. The second Tuesday of every month is for lymphedema patients. The third Wednesday of every month is for lipedema patients. Please visit lymphapress.com. You're not in this alone. You can get answers to your questions. Aside from having a wonderful pneumatic compression pump, the Lympha Press, to help you manage your condition, we're here to support you and cheer you on all the way. Many thanks to our all-star panel tonight. It was a joy to be with you, and I hope that you all received, I know you did, great information that you can take with you on your next trip. Have a great night, everyone.